Okay, so it looks like it's 10 o'clock. I think people are still trickling in, but we'll get started. We have a lot of content to go through with you today. Good morning. My name is Ariel Ruiz. I'm a partner in our assurance practice at the Bonadeo Group. Thank you for joining the annual tax exempt webinar series. Today, Mike Volmer, my partner, also an assurance partner at Bonadeo, and I are going to go through the information relating to New York State and federally funded human services. We have a lot of updates for you. We're going to talk about demographics and what's going on with the potential new budget that's being worked on. We have specific updates for each of the sort of the O industries. We're going to talk about funding opportunities that are out there, lots of different topics. We're going to try to get through everything that we have in the slides in about 45 minutes. That way, when we get to the end, if there are questions throughout, please put them in the chat, and hopefully we can have some good Q&A type session at the end of this. If not, we will follow back up if there are questions we don't get to via email for anybody that's involved. The presentation materials and links to the webinar replays will be sent out via email within the next 2 weeks after the event concludes. And also just a reminder, I know that it's Friday and we've had most of our sessions for the week for the tax exempt webinar series, but there is still, I believe, 1 or 2 sessions today. So if you are looking for more sessions or you need some more CPE credits, please go to the link, and I think it was just pasted into the chat, and register for those other sessions. So with that being said, I think we're ready to kick off the slides, and hopefully everybody's been able to log in and get Conferences IO set up on their end. So next slide, please. So this is just our general disclaimer. Anytime that we're doing a presentation, the information we're going to go through are the opinions of the presenter, Mike and I, and just kind of our general disclaimer out there. We can move to the next slide. So the first thing that we kind of wanted to touch on and take a look at, because we still consistently hear from our health and human services clients that the labor market is one of the most, difficult things for them to navigate. It's challenging. There's consistent vacancies, there's turnover, they can't pay people, all the things that I'm sure each of you have come across, especially in the year since the pandemic. So we kind of wanted to step back as part of this presentation and just kind of take a look at the graphs and the data that's out there and see where things really are. Now, of course, we're in January of 2025. This information is, I think, updated through about the 4th, September or so of 2024. But the first graph is just showing that the wage growth was strong during the pandemic years, but that we do think, and many think, that it's going to continue to decrease the percentages of wage growth. So if you kind of look at this graph, you can see, if you go back to 2020, that we're very close to where we were as far as wage growth was in the pandemic, right around when the pandemic hit. So we're back to kind of that same level. There was some really unprecedented increases over some of those years just to keep people where they were and be able to operate programs. Next slide. So this graph is showing us, this is directly from the New York State Department of Labor, so specific to New York State, the number of workforce that are out there, as well as the number of unemployed. And again, this goes through September of 2024. That was the most recent data that was out there when we were doing our research for this presentation, of course. So if you kind of take a look at this one, you can see back to the pre-pandemic years that we are right around the same number of unemployed people in September of 24. But the number of labor force has improved over these last couple of years. We're not quite where we were when the pandemic hit, but we're about 200,000 less than where we were at that time, right, at the beginning of 2020. So just kind of some general observations, also reviewing the data that was put out by New York State Department of Labor. So the biggest areas where they're seeing increases in the labor is the capital region, Binghamton, New York City, Long Island, Rochester, Syracuse, and Utica. So those were the largest metropolitan areas that they noted. And then they've seen big increases outside of metropolitan areas in Sullivan County, Allegheny County, Lewis, and Essex County. They also, I thought was really interesting, was to see that the most significant increase in the private sector jobs was with private education and health services. They said between September of 2023 and September of 2024, there was actually 122,000 more people employed, and that represented 5.5% of the total increase across all of the different sectors. So kind of stepping back and thinking about some observations from that, I think it's important, especially if you're in the areas where they're seeing these big increases and you're still continuing to see decreases or having challenges. One, I mean, you kind of have to look at the trends in your organization over that same period of time. What are you having for open positions versus turnover? And hopefully many of you are monitoring that consistently. And if you're not, you probably should be. But also, if you are experiencing some declines, why? If there's more people working, but we're experiencing declines, what's the root cause of that? Is there, a more of a focus need to be paid to recruitment and retention at our organization? How is our culture? What type of compensation packages are we offering to individuals compared to our competitors in the same sector? And also thinking about not only the number of people, but what can be done to utilize innovation and technology to maybe help with some of those shortages, what can be done to collaborate with other organizations, and then also thinking about outsourcing. I know that that's hard to think about with sort of your direct care type of positions, but administrative type of roles, is there any room for that at this point, or things that we should consider given the shortages or difficulties that we're having? Think we're going to have our first polling question, so make sure you're getting these in, especially if you need your CPE credit. So we kind of just want to gauge the audience. The majority of our revenue is derived from the following funding sources: OPWDD, OMH and OASIS, or behavioral health, SCD and OCFS, because those often complement each other, or really a variety of the above. Hopefully that is launching on everybody's screens right now, and we can continue with our presentation. Okay. So after looking at the demographics, we also wanted to start taking a look at what's being talked about for the 2026 New York State budget. Of course, this information is very new. It's not finalized. It's all in process right now. But there was a couple of different things that were put out in the last few weeks. Of course, the state of the state address had some key points from the governor. She talked about the fact that although the economy is strong right now and we had a better year than anticipated for the past year, when you look out the next few years, there's a $15.6 billion structural imbalance that she has to close by the year 2028. And by 2029, theirs is also, I think, another 8 or 9 billion on top of that if our funding stays consistent. The new budget likely will have some one-time relief to individuals and families. There was a lot of talk about that, not necessarily going to impact employers directly, but will give a little bit of relief for the individual people that are working for you, better child tax credits, maybe some one-time checks going back out to families for a reimbursement of taxes that were paid. There's a big focus on crime and mental illness programs, which that is a continuation. Of course, I think a lot of that was discussed in the prior year budget too. There's a $400 billion investment in downtown Albany that was noted in her State of the State. And then lastly, the big thing that she focused on was that Medicaid spending growth is right now at a 7.1% per year, and it's unsustainable. So those were mentioned in the state of the state. And then last week on January 21st, if you are curious and you want to see this and you haven't seen it yet, it's right online. The highlights from the budget briefing book that I think are most applicable to the individuals that are probably on this call this morning. Just a couple of things to go through and touch on. The total spending will be $252 billion for the new budget that's in process. Of that, there's about a 7.9% total increase, of which 14% is Medicaid and 4.7% is in school aid dollars of that 7.9%. The focus on housing programs continues, especially relating to shelters, supportive housing, rental subsidies, specifically mentioned HAP funding opportunities that will be out there, as well as an expansion of eShide programs, which I know many health and human service providers has had over the last few years that I've observed in my own client base, and those dollars should continue to increase and be out there. I mentioned already the $400 million economic and community development projects that will happen in the city of Albany. And then, of course, the continued concerns over the federal funding of the Medicaid program. And just to add to that, given the current times, this week, I would say there's, continued concern over funding of other grant programs as well, from the federal level. Some other areas in the proposed budget, the non-public schools will increase 4.7%, and there are some significant capital project dollars that are available out there for the non-public schools. Preschool in particular, there will be an increase in those rates of 5.5%, hopefully, and a summer school increase in rates of 2.2%. So these SED programs have had some pretty significant increases over the past few years. So that's good news for those. They talked about expanding the WIC program, but not just WIC. There's also a focus on many child care programs and maternal health programs that were mentioned within the budget narrative. There's also sorry. Thanks, Mike. There's also some implementation dollars for the 1115 waiver to help support the social SEN screening services that are out there. So the continued investment in that program, and we'll talk a little bit more about that later in the presentation, but I know there was also a great session put on by Bonadio this week on the 1115 waiver. A lot of different behavioral health programs had increased funding noted, so please refer to that document to see if it's specific to your organization if you haven't already. The big one I know for a lot of my client base is the concerns over the rebased rates for OPWDD, and the fact that in a lot of cases there was a significant investment. A lot of providers were unsure if that investment would continue. She specifically called out the fact that they will continue that investment at least for this budget period. They think that it's an important investment that was made in that system. So those rates should increase, as well as for all O agencies, there will be an inflationary increase of about 2.1% and $53 million of additional minimum wage increases that are dispersed. And that was specific to, as I mentioned, O agencies. So OCFS, OPW, OASIS, OMH, Office for the Aging was also mentioned in that too. Okay. So those are all the budget highlights. Of course, as we know, the budget isn't final, but those are the things that I thought were important to mention today. And I think we're ready to move on to polling question number 2. Hopefully this works. I know it sounded like there was a couple of issues, but employee retention and recruitment has improved at our organization in fiscal year 2024. True, false, or consistent with the prior year? So now Mike is going to talk a little bit about some of the specifics for some of the funding agencies.
Thank you, Ariel. Hey, Shan, if you could share, because I can't see the chat, the answer to the first polling question. I'm just kind of curious of the breakdown of funding as I kind of go through OMH, OASIS, SED, and some OPWDD updates. Um, I'll start with OMH OASIS, as you see here. There's a lot of dollars flowing around right now. Some of those being state, some of those being federal, a combination of the both. Um, so one thing that I would note related to all of the funding that is flowing around is make sure if you are getting federal dollars, you are aware of the fact that you may need to have a single audit. And that may be something that is new to your organization and maybe something that you've had in the past. But especially if it's new dollars and those are federal and it breaks the threshold, you will need to have a single audit. So keep that in mind. I got here, of course, the effect of the Mental Health Parity Act. I think it's a longer name, but I've kind of abbreviated it down to this piece. Um, I'd say the main thing that I take away from the Mental Health Parity Act is the fact that commercial payers have to pay at that Medicaid rate. And it does carve out state insurance plans as well as those self-funded insurance plans. Those are exempted from this requirement, but regular old Blue Cross, Blue Shields, and the like need to pay at the Medicaid rate. Also, increasing number of CCBHCs. We as a firm, John Miller specifically, has done a lot of work with CCBHCs in their coming about. There was an expansion awarded to about 13 organizations in the fall of 2024, just not too long ago, a few months ago. The CCBHC is still working off their 7/123 rates. The 7/124 rates will be subject to a federal rebasing, so keep that in mind, of course. Kind of on the ASUs side, there's a large amount of opioid settlement funds allocated in New York State, about $2 billion overall. Only about 365 or so million dollars of that so far has been distributed. So there's a lot of dollars to still flow on the opioid settlement funds. The 1115 waiver, as Ariel mentioned, there was a session yesterday. Hopefully, most or all of you were able to get to that John Miller and a partner from Bond Shennick King put on. A lot of good information. The takeaway here is, again, there's going to be a significant amount of money coming through social care networks to community-based organizations like those of you that are on this webinar. There's obviously, I think everyone has seen, a lot of lobbying occurring, advocating for better mental health, substance abuse policies, increased funding. We're seeing that increase in the funding obviously come through, as we've kind of talked about for a minute here. There is definitely an increased investment for better rates to pay increased wages, mental health courts, excuse me, the increased funding for crisis response like the 988 Lifeline, mobile crisis units, crisis intervention team training. There's also, especially on the OMH side, a focus on youth. Youth Advisory Board has been formed, and then there's additional funding for children's community residences as well. On the SED side, I do not want to get into how the rates are actually calculated because it's super complex. So on a higher level, 4.3% trend for 24-25 school year. They are using this higher of methodology, which is much more convoluted than the two little bullets that I have here. But it sort of essentially boils down to this: 22-23 reconciled rate plus your trend of 10.82, that's two trends combined, or your final 23-24 prospective rate plus 4.3%. It's going to be the higher of each, whichever of those is higher, that's the rate that you'll get. The big item here, I think, is this kind of second half, I'll call it, of this slide, the 11% surplus retention. That is 11% for essentially the last 2 years, I'm going to call it 22-23, 23-24, as well as this school year that's going to be ending 24-25. It goes down to 8% for 25-26, 5, and then 2, and then goes away unless something changes. Any surplus that you have from one to 11% should be recognized in the financial statements as well as in the CFR. If it's less than 1%, you by all means keep that surplus still, but you don't have to have a disclosure in the financial statements for it. They will accumulate until you spend them down. So you, in theory, could end up with much more than just 11% if you have significant surpluses year after year. I would say that is certainly not something you want to strive for. They have said that they will hold harmless your rates when you have surpluses. But from a practical standpoint, and this gets into the very first or second slide that we said that our opinions are our own, not necessarily those of anybody else or the firm. My personal opinion is if you have surpluses for 2-3 years that are fairly significant, I just don't understand how SED could not affect your rate because of that. It to me is essentially kind of a sign that if you're having surpluses year after year, you probably don't really need all of that funding. And you may argue that we do, but that's the way at least SED, I think, is going to look at it after several years of surpluses. So absolutely, as that fourth bullet says, you should have a plan to spend down those surpluses, as well as to ensure that you're not going to run consistent surpluses year after year. There's been much discussion about this second to last bullet here and the last bullet. Surpluses can be used to cover prior outstanding debts. There was a lot of discussion. There was at one point in an SED memo some wording added in that said / and expenses or something along those lines. Expenses from prior years is not what I would really focus on. I would focus on the outstanding debts, and that has been clarified in a memo that was put out, I think, in October, right before, maybe November, actually, right before the 6/30 CFR deadline, that tried to, and I would say tried to because it was clarifying in some ways, and there was some still kind of questions to be answered. The key things that I think come from that memo and from what SED is trying to get across is that it needs to be reimbursable expenses that were defined or are defined in the reimbursable cost manual. So you always have to have your focus as an SED provider on that reimbursable cost manual. Is the expense in line with what is allowable in the reimbursable cost manual? Going forward, you can use it for expenses in future years. Again, got to be in accordance with the RCM. It can be in excess of allowable and reimbursable costs in that current year. And it could include costs that are in excess of both total cost screens, direct and indirect cross screens. Turn it back over to Ariel to go through a couple of IDD slides before I turn back over to myself.
Thanks, Mike. So just a couple of things to touch on. I thought this graph was actually really nice to see. I don't know if any of you that have OPWDD funding have read their 2024 annual report, but there was a lot of good information in there on the updates that they've made. Now, this is year 2. 2025 will be year 2 of their strategic plan. And they had a big focus on workforce, technology, innovation, and enhanced services. Those were the main points in their strategic plan. They do have I thought this was interesting, there's a new Ombuds program that's a lot of information about it right on their website. And it really is to help with barriers to service and concerns that are coming forward from family members. I think a lot, and actually speaking for myself, having a family member with a disability, I've had to advocate a lot more than I had in prior years. And I think there's a lot of concerns out there with maybe the care managers not referring them or getting them into programs on time. Again, this is my own opinion and my own thought around why this program has come to play. But I think some interesting information that's announced on there. And then I just think it's kind of interesting to see that sort of the breakout of the people that are being served in these programs. And just, over the past, I would say 10, 15 years, there's been a push to community-based programs. But as we can see from this graph, most of the spending is really still in the certified programs, the certified day sites and the certified residential. They are serving for 2023, $9 billion of the Medicaid spend is in these programs. And I think a big thing to also point out is if you look at the bottom, the senior portion, the amount per senior. So we know that there's a need to tackle the aging population in OPWDD and how they can address this going forward and try to reduce some of the Medicaid spend perhaps on the senior population. I think will be a focus is my guess on something that may be a focus for them. On the next page, just some highlights of what they talked about for 2024 and also moving forward into 2025. And, I do think a lot of these things, especially the data, will trickle through to provider side. They're continuously updating their own state systems to gather data because they know that it's a key element in figuring out things as they move forward in their strategic plan. So making sure that you, on your side, on the provider side, you have the right systems in place to capture the data is going to be very important, whether it's financial or programmatic. The other thing they talk about a lot is the housing strategy, and they note that residential is consistently a concern among individuals. And I hear this from the provider side, that placements take way too long. It could take months and months. They know that they need to streamline processes and get people in programs, focusing on the higher need individuals first. So that is a priority that they've set forth for 2025 and beyond. I also thought it was interesting so they've done 2 reports. One's in process and one was completed. Right now, they have an independent review being done of the care coordination model to assess effectiveness. So stay tuned on that. In early 2025, there'll be some reporting that comes forward on that and how they plan, if there are concerns, I would guess how they plan to address it moving forward. And then the managed care report that I'm sure many of you have seen was also an independent review that was done by OPW engaged to have done. That was completed back in September. And essentially, no final decisions have been made for managed care model for this population. However, they mentioned that they would not advise this to be applied to all services. So things like residential, probably not, but perhaps for the medical and behavioral services that individuals with disabilities are receiving, managed care will apply for them. And we know that there's a little bit of managed care going on right now for the individuals with those types of services. The last thing that was discussed in here was the behavioral and crisis services still being an essential need that's lacking. I know that I've discussed this. I know I have clients that are starting to look into this as maybe a new funding opportunity or a new program that they can provide. And later on in the presentation, there is some funding that's starting to flow on these services if you think that's an area that you want to explore as a provider. Mike's going to touch on some updates surrounding the rates for OPWDD.
Thank you, Ariel. So, it's not easy out there as an IDD provider. Now switching focus kind of to OPWDD, which I did get a chance to kind of peek at the results from the one polling question. And more than half of you, almost 60%, have a mix of funding, and about 20%, I think it was, specifically OPWDD. So this affects, I think, probably the vast majority of you on the line here. 3 different rates over the course of 2024 calendar year: 1-1, 4-1, 7-1. 4-1, 7-1 having a couple of unique things to go along with them. I'll get into the 4-1 COLA in a minute. 7-1 rates released on the absolute last day of the calendar year, right? 12/31, sometime around mid-morning, late morning. That's causing a bit of a stir and some spirited discussions that I have also been a part of a couple times. I would say one really wonderful thing, I don't know where we ended up coming up with an extra $500 million, but $500 million got added to those rates. That's a blessing and a curse in some ways, I would say. And I pointed out in this one point here, the OPWDD acting commissioner specifically mentioned in her email related to those 7-1 rates that she is she's hopeful that this rate enhancement will allow you each to increase hourly wages for your direct support staff. Does that say you have to? Is that written into regulation? No. Is that kind of a good probably thing to keep in mind as you're spending down the increased funding you got? I think yes, it absolutely is. Um, Generally, everyone got increases. I know not everyone. There was definitely some that did not. And often we've seen very large increases in the 7-1 rates. So you got a number from the draft, and then you got a bigger number, assuming you got an increase to begin with, come 12/31. So what are you going to do with all of that? Well, there's a couple of accounting pieces to this, right? There should be an asset if you had an increase or if you had a decrease of liability that should be booked in calendar 2024. And this admittedly is geared towards, 12/31 filers, not necessarily the fiscal year 630s. For the portion of the rate increase or decrease that relates to those 6 months of 2024. It is possible to accrue some expenses back to 2024 as well. And I say possible because it definitely depends on the type of expense, kind of your documentation surrounding that. I don't want to make any blanket statements here for either our firm or CPAs in general. There's been, again, I think, spirited discussion on provider calls. There's been spirited discussion between a number of CPA firms about, what advice we can kind of give. And quite honestly, it boils down to you have to have a conversation with whoever your audit firm is and your audit partner and your audit team. And what is really acceptable to go back and accrue. The one thing that I will say that is kind of, I think, something that we all agree on is you can't purchase something in 2025 and then say, well, that's really related to 2024. It's really just not going to be acceptable. What you might be able to do is give some rate increases to your folks, and that may be allowable to push back into 2024. Why is that important? Well, what year are they going to use for rebasing again? Is it going to be 2024 calendar year? Is it going to be 2025? Is it going to be 2026? I wish any of us knew. I don't think any of us do. My gut tells me it will not be 2024 calendar year, but I have no real backup to say that that's going to be an absolute truth. So please do not take it that way. But my gut tells me it's probably going to be 2025, perhaps 2026. And obviously, for fiscal year filers, it could be 24-25 or 25-26. I kind of lean slightly more towards 24-25, but I think it will all come to light. Unfortunately, too late for us to make real decisions with that information, I guess. So how are you going to spend these rates now and in the future? Are you going to be able to accrue some things back? Are you going to be able to give some increases to folks that relate to 2024? If you've had those discussions prior to the end of the year, then you most likely can do that. If you have not, then it's going to be hard pressed to say that you are going to be able to accrue back expenses. So it's really a plan for spending down. I'll say spending down because you don't have to, again, necessarily use it for certain things. But again, you go back to that comment from the acting commissioner. If you do not increase your wages for specifically your direct support staff, I think that OPWDD will not look upon that very highly. So something to keep in mind. I know we've had some clients say, well, I have some life safety issues at homes that I was really just waiting for the dollars to flow in. By all means, if you have life safety issues in homes and residential settings, you have to address those. And I would personally advise against things beyond much of a life safety issue. If you are just want to spruce up some homes, I think there is a better use of money, but that is not to say that you cannot do anything like that. The next slide, excuse me, is a polling question again. So we've been participating in meetings with our local SCN, Social Care Network, and we believe that we will be able to provide services, take part in the 1115 waiver funding. Yes, not sure about the funding. No, we don't have capacity. And what the heck is the 1115 waiver? So I mentioned the COLA related to the 4/1/24, 2.84%. That is specifically, this is the wording they used, to be used for promoting the recruitment and retention of staff. 1.7 of that very specifically has to be in the form of targeted salary increases to quote eligible individuals. Well, who are those eligible individuals? You see that kind of listed out here. They give specific CFR codes related to them, but it's basically your 100s, 200s, 300s, and then a little bit of 500s. It does not include 600. It does not include executives, and that's the key point here. It's basically just about everybody except for executive level staff. That remaining 1.14% can be used for some of those other things. It can be used for OTPS other than personal services. It can be used for equipment, property. You can enhance fringe benefits. It can't cover the increased cost of increased fringe from the enhancements, the wage enhancements, but it can be used to cover increased benefits. And then I have a double asterisk on this last one, executive wage increases. It's a double asterisk for two reasons. One, my reading of the documentation that OPWDD puts out doesn't exclude executives from that kind of remainder piece in the way I read it. The second asterisk is because I don't really think you really probably want to use any of it for executive salary increases. I think in the light of optics, it's probably advisable to use it all for everything but executive enhancements to wages. That's not to say you can't use other funding, but I would be very careful to probably not use any of this 2.84 or the 1.14. Today is the day. If you have not completed your survey and attestation today, I would get off this call as soon as it's done and get that finished up. It has to be submitted today. It has to be signed by both the president, CEO, executive director, whatever your terminology is, as well as the board chair. You also have to communicate to all of your employees how you're spending that 2.84. And this is another piece of kind of going back to the executive piece. Do you really want to tell your people that you're using some portion of this 2.84 to give executive increases? I doubt that you probably do. I'm going to say I doubt that almost anyone did do that or planned to do that. But again, just something to keep in mind. It does have to be communicated how you're using those dollars. They want it to be very transparent. And in the interest of transparency, they said they may elect to publicly post the results of each of those surveys. I'm going to turn it back over to Ariel to talk about some self-direction.
Thanks, Mike. Okay, so from a self-direction program perspective, not a whole lot of updates there. And I'm guessing maybe only a small percentage of you have these programs, because what I've noticed is they're pretty spread out among providers, and some of the providers that have them have a big significant portion of the individuals. But just to touch on this quickly, the program has been growing. It did increase about 120% since 2018 in the number of individuals and spending. The big question that's out there is really the provider budget process. So right now, for any state dollar spending, at the end of last year, people were kind of in a holding pattern on spending the state dollars because a lot of them had run out of the allocation to the provider, not to the individuals, but what was allowed on the provider side. So previously there was a 5-year budget model for the state spending portion of self-direction. That's going to be moved down to a 3-year model, and those are in process now. And the point of it is that the money is probably all there. It just needs to be distributed appropriately. So while some providers were at the end of the budget and probably overspending and may even in some cases could lose out on some of that reimbursement, others were likely well under the cap. So they kind of have to analyze that and move the money around accordingly depending on need there. So that's going on currently. And the other thing with that program, just a couple of things, reminders, technology investment is so important with self-direction. What we've observed over the years is if you're not investing in technology, it's a really manual program. If you're trying to do it without a system that's specifically designed for self-direction, the billing and the way the program works is so unique and different than your traditional grants or Medicaid funding. So really important that you evaluate the technology that you're using for that. Because you could be losing out on reimbursement, or you could be having issues that you're not detecting without the appropriate technology. And the other thing is it's a whole separate set of internal controls and risks that are surrounding those dollars. So just if you have self-direction, hopefully these things you're already aware of, but just something that I wanted to mention. And then lastly, and on the next slide, I'm going to talk a little bit about what's going on with the CDPAP program, but it's a very similar model to self-direction. It's not exactly the same, but there's a lot of similarities. The spending in self-direction is a fraction pretty much of what's spent in the CDPAP at this time, but what's happening with CDPAP could eventually be put forward to self-direction. So we just want everyone to kind of be aware of that as well. So next slide, just to highlight what's going on with the CDPAP funding that's under the Department of Health. The move to the statewide FI began, and enrollment of individuals is in process across the different community partners. So there are about 30 community partners that the statewide FI is currently working with. And I'm sure many of you that are following this have seen that there's a lot of lawsuits that are filed or in process there, and a lot of negative press surrounding the change in this model where they've had to move everything from the community providers to this individual statewide FI. Managed care plans have also been upset about the transition, and that's been publicly, there's been articles written on that. And then lastly, just as most of us would be, there's a concern that the transition can interrupt service delivery to the people that really need these services. So a lot of things going on there. We don't really know, what's going to happen. I think as the April 1st deadline gets closer, we'll likely know more about how this transition is going and if they'll be able to kick things off right away or sort of what's going to happen with that program. So pay attention. If you have obviously that funding, you're paying attention, but it's an interesting thing to see. And again, it could change some of the other programs that are provided like self-direction through OPWDD as well. So the next slide, we're going to talk about some funding opportunities, just so everyone's aware what's out there. Now, interestingly enough, in the slide, in the question, just kind of gauging the 1115 waiver funding, we keep talking about it. 25% of you said, what is the 1115 waiver funding? So we want to just make sure everyone's aware that this is out there. We don't really have time to get into specifics today, but there's articles on our website. We have lots of information on it. If you want to know more, I would suggest, and if you weren't in John's session yesterday, I think Mike said it was, that you reach out to one of us at Bonadio if you think it's something, if you're providing community-based behavioral health in particular type services, different types of services that could be reimbursed eventually through those funds. So talk to us and we can kind of walk you through. The other thing that most providers, I don't know how much time everyone has. We're all pressed for time, but looking at the Grants Gateway often just to see kind of what's out there. I took a look a couple weeks ago just to see what the current programs were out there that there was funding for. There's some additional Victims of Crime Act money that all of these, I should say, have applications due in March of this year. So they have not passed. These are all open opportunities right now. So the Victim of Crime Act funding, there's some OMH, home-based crisis intervention statewide funding, and that was focused on central and western counties of New York State, about $12.6 million of funding available for those grants. There's also some OMH home-based crisis intervention DD pilot dollars. So this kind of goes back to what we were talking about with IDD and the need for the behavioral health side of things, kind of integrating all of that together. That's a small pot of money, 3.6 million, because it's a pilot program. I would guess, they don't put a lot to that, but I think that stay tuned in that and take a look if you think that's something you're interested in. And then expanding OMH Youth Assertive community treatment in those various regions that are listed. And that was an opportunity that's out there for $40 million of funding. Pay attention, just often, I don't know, once a quarter or so, once a month, going there and kind of seeing what's out there. But I think what I often talk about with my clients, and Mike probably does as well, is that diversifying your funding is key, especially given the struggling times that we have. But you also kind of have to balance that with the administrative burden and cost of perhaps providing some of these programs. So finding the balance between how you can do that is really part of your strategic planning moving forward with the services that you can provide, or new services that you can provide, is really important. There was also some federal funding opportunities that are out there on the HRSA website in particular. There was a lot of open programs with behavioral health, healthcare in rural communities, opioid and addiction programs, and Mike touched on a lot of that funding earlier on those slides. And then again, this focus on maternal and child health issues continues not only at the state level, where there be a lot of opportunities, but also at the federal level. So some of you I know are providing those programs already. So there could be some complementary funding out there that you should maybe consider taking a look at. And then also continuously checking with your local municipalities to see what they have out there as far as RFPs is important. And then lastly, there are private grant opportunities out there. I know over the past few years, we've seen a lot of funds flowing from certain foundations. In particular, there's a New York Health Foundation out there that I noted had a lot of opportunities that they were talking about on their website. Mother Cabrini, I know I saw a lot of that funding up front. Some of that I think has dried up a little bit, but that is probably out there. So just some things to be aware of. To take a look at if you're trying to diversify and bring in some new opportunities. We're getting towards the end here. So OMIG, we've got a couple more topics. OMIG, I'll try to go quickly because we wanted to leave a few questions. I don't see any questions yet in the chat, but stick them in there if you guys have anything. Just some best practices for OMIG. I sat in a webinar that they did back in December. I thought it was an excellent webinar. If you haven't listened to one of their provider engagement sessions, something like that it's called, that I would recommend that you do. But one thing that they kept saying over and over was they know that people are not following self-disclosure rules, and they should be. It's such a small percentage of people are submitting self-disclosures compared to the number of Medicaid claims out there. So think about that at your organization. If you're not doing that from time to time, I mean, everybody makes errors. There's always, it's okay to make mistakes, but you should have a process in place. You should be submitting self-disclosures. And they said, if you're not, that increases your risk for being selected for a review or audit. So that's one thing to be aware of. Number two, they talked about the new compliance program reviews that have been ongoing. I know my partner Paul probably had a session on this already this week and talks about it often, but just be aware that that's ongoing. They said through December, the reviews they had about a 73% average score. There were no failures. But if you do fail, there is a fine of $5,000 a month if you're out of compliance. So again, something to be aware of. And if you have compliance concerns, let us know and we can connect you with the right people here to talk to. And then just some best practices. If you do get selected for a review, investigation, or audit, assemble your own internal team as soon as possible. You may even think about including an outsourced person in that if you feel like you don't have the expertise to handle it, if you are concerned or things come up. And the other thing they emphasized was, we know sometimes documentation's missing. We know sometimes you can't find something or there's an error and maybe you see it, but you don't say anything hoping that we don't pick up on it. They said they would rather you communicate and ask them questions up front. It doesn't cause you to have any dings, not to wait until the conference call to talk about any of those issues, because likely they will pick up on them anyways when they review the information. And that they will work with anyone on repayment terms and make sure that you're following the new online self-disclosure process. Back to Mike.
Thank you, Ariel. I'm going to spend very little time, I think, on these next two slides because just so much unknown. Federally, again, very little clarity on what could happen at the federal level. But a couple of points of reference, kind of. Medicaid funding at the federal level is about $600 billion a year. There's a state share of that, of course, that is, I think, around $400 billion or so a year. New York is the second largest recipient of federal Medicaid dollars, only behind California, and almost twice as much as the next closest, which is Texas. So New York is a very large user of the Medicaid system as a whole. As a whole, again, the IDD population specifically makes up about 13% of the enrollment, but a third of the spending on Medicaid. And as that last bullet kind of indicates, and as anybody who's heard anything in the news over the last couple of weeks, the current administration certainly believes there's some significant overhaul to the Medicaid system needed, including some proposed extreme cuts to Medicaid as a whole. I think $3 trillion over the next 10 years is the number that I last heard, just a smidge over $3 trillion. If that comes to fruition at that level, it will, without a doubt, have an impact on our state as well as every other state. And that could be a significant negative impact, of course. CFR wise, the next slide, once I get to it here, happy to report there isn't really a whole lot of new stuff in the CFR this year, thank goodness. They did release the manual, appendices, and transmittal letter already in early January, mainly just adding and deleting some new programs, some line definitions, adding some definitions to certain lines or updating them. They did update the wording for bad debt to be credit losses. This next couple of items here I found interesting. They now require SED filers to have a CFR IV. That's really just a series of questions. Did you file your 990 timely? Have you had a federal single audit if you need to? Things like that. And then the last one I found super interesting, that there is now a question in that CFR-AV specific to SED providers, asking if your executive director or CEO completed the required annual online CFR training. I'll be honest, that was something that I didn't know was a requirement until I read the manual and the updates. And our last polling.
I was going to say, I was on with an SED accountant that I've been working with on a client recently, and she said they are absolutely stressing that, and that the executive directors, without a doubt, need to be doing that and signing off on that for the attestation. So make sure that that's occurring if you have that funding.
Thank you, Arla. Last polling question. I am assuming it may have launched already. If you had to choose one topic that is a pain point for your organization, what is the number one? Is it the labor market, shortage of workers, slow reimbursement from payers, inadequate reimbursement from payers, or lacking strategic oversight from the board and upper management? Last slide or two is here. Our contact information. Kevin Testo is the industry lead for the human services, and of course, Ariel and myself. And I'm going to turn off the slides so I can see people or see at least the big screen and any questions. Which last I saw, there was none, Ariel, either. But
no, I don't see anything in here. And that's okay, because we did make the 50-minute mark for the CP, but happy to stay on another minute or two if anybody wants to stick something in the chat.
I don't know if I'm shocked or if we just did such a great job covering everything else.
The last topic, the labor market, was the 50%, paying slow reimbursement 17%, inadequate reimbursement 24%, and the strategic oversight 9%.
It pains me that the labor is such a difficult thing still. I feel like it's just been every presentation that I do for our boards, our audit committees, finance committees, I feel like I say the same thing, but it's still super relevant, unfortunately.
It is. It's tough.
All right. Give it another 10 seconds.
And just thank you guys for being with us today. As mentioned at the beginning, we will send out the presentation in the next 2 weeks. And if there was any issues hearing, I know I saw 1 or 2 people comment, hopefully in the recorded session, you can always go back and catch up on anything that you may have missed. And please reach out to us directly. You have our information. Oh, here's one. Do you have any data on employment rates in Livingston? The data that I had was specific to the whole state, but we might be able to find something on Department of Labor for Livingston. Mike, anything?
I do not have anything off the top of my head.
Yeah.
All right. Well, everybody can have a few minutes before, undoubtedly some of you have an 11 o'clock meeting, I'm
Right.
sure.
Running from back-to-back meetings will make it a little easier on you today. Thanks, everyone. Hope everybody takes care and has a good first, couple quarters of the year.
Good full year, hopefully.
Good full year, but we got to get through the winter
Excuse
first.
me. Thank you all.
Bye.